The Minnesota Medical Association did not want the ratings to be released, but today Medica made them public anyway, saying it stands by its rankings. It's a big deal because it's the first time Minnesota doctors have been rated by name according to how they perform on a variety of national measurements. The data went live at midnight, but the Medical Association worries some of it is not accurate and not fair. Carol Evans' Trisha Volpe reports.
When it comes to choosing a doctor, many people rely on word of mouth, reputation, referrals. The folks at Medica, the state's second largest health plan, hope consumers will now factor stars into their decision. Medica has started posting doctor ratings on its website, the result of a study of 3 years of medical claims data analyzing how well doctors followed national standards for care. Patients can see how their physician compares to others. 1 star for quality, a 2nd star for efficiency.
There's many factors that go into how a consumer makes a choice for just about anything, especially their doctor. That's a pretty intimate relationship, and this is just another piece of information to help guide that choice.
While many doctors encourage comparison shopping, some say when it comes to Medica's new rating system, the data is unreliable.
We think it's incredibly important, and it's also incredibly important to do it right.
Dr. Benjamin Witten practices internal medicine and is past president of the Minnesota Medical Association. He says Medica misclassified many doctors' specialties and says the data applies more to clinics rather than individual doctors. Witten wants consumers to be informed, but urges patients to be wary of the stars.
Look at the data, talk it over with their physician, with their clinic, but they should ask Medica in the future to do reliability testing on this data.
Medica officials say they will continue to fine-tune the data and are working with individual doctors to fix mistakes.
Today's a beginning. I would like to see this get better. I would like to see as a community that over time we can incorporate outcomes data into this and satisfaction data into this, make the tool better over time.
Medica officials say Minnesota physicians scored the best compared to their colleagues in other parts of the country that use the same rating system. Medica looked at 9,400 doctors. 50% received 2 stars, 20% got 1. The rest either had no stars or there wasn't enough data to rate them. And Julie, I'm happy to report I did look up my doctor today. 2 stars.
I think a lot of people right now are logging on
I'm
to
sure.
do the same
Yes,
thing.
exactly.
Right. Thanks, Trisha.
Yep.